Now, why are we excited about this for the first time? Because we now have therapies, and these therapies are monoclonal antibodies that target the amyloid, but also mobilize it. And the theory is there's too much production or too little clearance, but it's stuck in the brain, right? And these antibodies, they grab it, they essentially dislodge it, and then allow the normal brain clearance pathway to get it out. And what is the normal brain clearance pathway? What's thought to be this lymphatic system, where there's a bulk CSF flow from the periarterial space through the extracellular space to the perivenous space and out into the body's lymphatic system. Now, if you see these little brown bodies here, these are supposed to indicate amyloid plaque, but it could be any toxin that occurs within the brain, and it just washes through every day. And this happens more actively when you sleep, which is why sleeping is really, bad sleep is one of the big risk factors for clearing this disease. And we talked about this earlier with contrast agents, where they stick in the brain, and the same process just washes them out. The first drug to achieve full approval is a drug called lecanemab. It's pronounced Leqembi. The actual clinical product was approved in July of 2023. In the trials on this agent, patients with mild cognitive impairment and mild Alzheimer's dementia showed a 27% slower rate of cognitive decline. You can see it here. This is cognitive. This is over time. This is a cognitive testing. You'll notice the slope of the patients on placebo, and you see the slope is different for the patients on lecanemab. If on an extension of this trial, if you looked at the patients with the earliest stage disease, when they have the least amount of tau, and this would be a low tau, and this would be a normal, and this would be a high tau example from EZI, 76% of the patients who had low tau compared to placebo, 55% had no cognitive decline, and that's really big. And 60% of that same patient group had clinical improvement in 18 months, and they only saw that in 28% of the placebo population. So in general, the theme that starting earlier is important. From you're eligible only in the early stages, and the earliest stages you'll have the best results are very, very important. Now, there's